property from our site yet. And moving on, the active COVID-19 cases across India have risen to 7,409 with 273 fatalities, and 764 people have been discharged so far. And these are the figures now we have the figures coming from all the states of the Delhi has the Tamil Nadu has 969, and the Rajasthan has 676. In Madhya Pradesh, the tally is 564 and the 452. Uttar Pradesh 552 and 402, 45 and the 5. From Gujarat, the report, the number is coming 432 and 366. From Andhra Pradesh, 381 and 364. And the Kerala number is 374 and 230. From Karnataka, the number is 226 and 183. Jammu and Kashmir, the number is 224 and 214. From Haryana, the number is coming 185 and 153. And from Punjab, these are the active cases I am just giving you, 151 and 135. From West Bengal, 134 and the active cases 110. From Bihar, 64 and 44 is the active case. And Odisha, 54 and active is 41. Uttarakhand, the number is 35 and the active case is 30. Himachal Pradesh number is 32 and the active leads to 25. And Assam 29 and 28 is the active case. And Chhattisgarh number is 25 and the active cases are 15. Chandigarh 19 and 12 are the active cases. Jharkhand numbers are 17 and 16 active cases. Ladakh 15 and 5 active cases. Andaman and Nicobar Island 11 and the 1 is the active case. Puducherry 7 is the number and the active case including is 6. Goa 7 and 2 are the active cases. Tripura 2 and 2 are the other active cases. Manipur has also 2 in numbers and 1 is the active case. Arunachal Pradesh 1 and 1 is the active case. Mizoram has also 1 and 1 is the active case. So this is all the, we have just given you the numbers and the total COVID-19 cases in India. The confirmed cases is 8,447 and the active cases are 7,409 and 765 and 273. These are the discharged people. Now moving on, in the daily briefing, Joint Secretary of the Union Health Ministry, Love Agarwal, gave the data for the day. The Ministry of Home Affairs Joint Secretary Punya Salila Srivastav said that the government is working with the states to ensure door-to-door delivery of essential commodities. She said that curfew passes are being issued for suppliers of essential goods. She said that Cyber Dost, a portal to tackle cyber crime, especially financial crime, has been launched since there is an increase in online financial transactions. Health Ministry Joint Secretary Love Agrawal said that 80% cases are mild and asymptomatic and are treated at COVID care centers. And 1,05,000 beds available for the COVID patients. And number of the hospitals and the isolation beds increasing every day. 500 beds dedicated at the Safdarjung for COVID-19. 444 additional ventilators being provided in Andhra Pradesh. 1,200 beds dedicated hospitals in Ahmedabad. Private hospitals like Apollo and Max Hospital have also made arrangements for patients. He maintained that the social distancing is a very important component. And meanwhile, the ICMR said that the work on developing the vaccine is underway and 40+ candidate vaccines are under development. And similar to phase 1, where 5,000 coaches have been transformed into isolation wards, in phase 2, 20,000 trained coaches will be transformed into isolation wards. And so far, total 1,86,906 samples have been tested, and of which 8,356 have been found positive for COVID-19. Health Ministry in extra prepared is in the case of exponential rise of the COVID-19 cases, and there is no need to panic as government is planning things so as to manage the situation.
आज की तारीख में हमारे पास मान लीजिए 8,356 पॉजिटिव केसेस हैं। तो जैसे इससे पहले हम लोगों ने बात की है कि इसमें से करीब 20% केसेस जो होंगे वो कि मॉडरेट सिम्टम्स या जिनको आईसीयू सपोर्ट की जरूरत होगी। तो अगर हम उसके हिसाब से इसका विभाग करते हैं तो हम देखते हैं कि आज भी हमारे को 1,671 ऐसे पेशेंट्स होंगे जिनको कि स्पेसिफिकली ऑक्सीजन सपोर्ट या क्रिटिकल केयर ट्रीटमेंट की जरूरत होगी। तो यह फिगर मैं आप लोगों की दृष्टि में इसलिए लाना चाहता हूं कि ताकि हम समझें कहीं पर कोई भी पैनिक क्रिएट ना हो, कहीं पर प्रॉपर क्लैरिटी रहे कि गवर्नमेंट इज अवेयर, गवर्नमेंट इज प्लानिंग इट्स थिंग्स in being over prepared so as to manage the situation.
The centre has announced that pro-poor initiatives under Pradhan Mantri Garib Kalyan Yojana as part of economic response to COVID-19. This is aimed at alleviating the hardships faced by poor due to economic disruption by COVID-19. And as per the scheme, free LPG refills are to be provided to Ujjwala beneficiaries over the period of 3 months from April to June 2020. As on date, oil marketing companies have initiated transfer of rupees 5,606 crore into 7.15 crore and PMUI beneficiaries account for availing the free delivery of LPG cylinder under the PMGKY. And since the lockdown, 50 to 60 lakh cylinders are being delivered daily in the country. When there is nationwide lockdown and the people are staying home to stay safe, LPG delivery boys are all those in the supply chain of the LPG and are working tirelessly to ensure that clean fuel reaches people directly at their homes. Now moving on, the Union Minister for HRD, Shri Ramesh Pokhriyal Nishank has launched a web portal, Yukti, or Young India Combating COVID-19 with Knowledge, Technology and Innovation today. It's a unique portal and dashboard to monitor and record the efforts and initiatives of Ministry of Human Resource Development. The portal will cover the various initiatives and efforts of the institutions in academics, research especially related to COVID, and socially initiative by institutions and the measures taken for the betterment of total well-being of the students. It will also allow various institutions to share their strategies for various challenges which are there because of the unprecedented situation of COVID-19 and other future initiatives.
मंत्रालय ने एक युक्ति पोर्टल तैयार किया है। ये युक्ति पोर्टल ऐसा प्लेटफॉर्म होगा जिसमें हमारी सभी संस्थाएं चाहे हमारे आईटी है, एनआईटी है, आईसर है, आईपीएस है, मानव संसाधन विकास मंत्रालय से तमाम जुड़ी छोटी बड़ी संस्थाएं हैं, वो क्या क्या काम कर रही हैं और वो क्या क्या अभी तक उन्होंने अनुसंधान किया है, वो सभी इकट्ठा एक स्थान पर होगा। और वर्तमान परिस्थितियां जब पूरी दुनिया कोरोना वायरस के इस महामारी से जूझ रही है, इस संकट से उबरने के लिए ये तमाम संस्थान क्या शोध कर रहे हैं, क्या अनुसंधान इन्होंने अभी तक किया है, वो सभी जो उनके प्रयास हैं वो प्रयास एक स्थान पर प्राप्त होंगे।
Center has buffer stock of 534.78 lakh metric tons of rice and wheat and monthly PDS supply in 60 lakh metric tons. Food and Consumer Affairs Minister Ram Vilas Paswan has assured that that there is no shortage of food grains in the country.
देश की जनता को ये आश्वस्त करना चाहते हैं कि हमारे पास में खाद्यान्न की कमी नहीं है और जितना ज़रूरत है उससे हमारे पास में 2 गुना अधिक हमारे पास में खाद्यान्न है। हम रेलवे को भी धन्यवाद देना चाहते हैं कि लॉकडाउन होने के बाद अभी तक 1056 रेल रैक जो है के माध्यम से करीब 30 लाख मेट्रिक टन अनाज का जो है उठाव और क्या कहते हैं कि ट्रांसपोर्टेशन परिवहन हो चुका है। 3 महीना का हम लोगों ने सबको फ्री में राशन देने का निर्णय सरकार ने लिया कि 3 महीना तक जो 2 रुपये किलो 3 रुपये देते हैं उसको हम नहीं लेंगे, फ्री में देंगे 81 करोड़ लोगों को।
Ram Vilas Paswan said that the government will deal strictly with black marketers and in this crisis situation.
हमने बहुत ही हिदायत दिया है कि जमाखोरी के खिलाफ में भी दिया है, एमआरपी के खिलाफ में भी किया है, लेकिन हमें इस बात का अभी तक खुशी है इसमें क्या कहते हैं कहीं उस तरह की शिकायत जो है सो नहीं आ रही है। और हम पैनी दृष्टि रखे हुए हैं कि कोई भी चीज़, चूँकि ये जो है कठिन घड़ी है और इसमें क्या कहते हैं कि व्यापारी हो जो भी हो सबका काम है कि लोगों को सहायता करे। प्रधानमंत्री दिन रात लगे हुए हैं, तो उस परिस्थिति में यदि कोई मुनाफा कमाने की इसमें कोशिश करेगा तो उसको बख्शा नहीं जाएगा।
In view of the Supreme Court's directions regarding welfare of migrant laborers housed at relief shelters and camps in different parts of the country, Union Ministry of Home Affairs has written to all states and union territories to take necessary action in compliance of the directions of the court while implementing lockdown measures to fight COVID-19 effectively. The court directed that the adequate medical facilities besides proper arrangements for food, clean drinking water and sanitation be ensured for migrant workers at relief camps and shelters across the country. Further, trained counselors and or the community group leaders belonging to all faiths should visit the relief camps and the shelters' homes and deal with any consternation that migrant might be going through. The court also observed that the anxiety and the fear of the migrants should be understood by the police and the other authorities, and they should deal with the migrants in a humane manner. And COVID-19 is caused by the novel SARS coronavirus 2. A large number of infected people are also recovering despite not having any specific treatment. This is because of antibodies produced within the body in response to the virus invasion. Efforts are in full swing globally to produce therapeutic antibodies against SARS-CoV-2.
कन्वलेसेंट प्लाज्मा एक टाइप की थेरेपी है जो कोविड-19 में कुछ स्टडीज़ ने यूज़ की है और थोड़ा बेनिफिट भी दिखाया है। ये एक नई थेरेपी नहीं है, ये कई दफ़ा यूज़ हुई है। इबोला में भी कुछ हद तक यूज़ हुई थी और कई और इन्फेक्शन में कई वर्षों से ट्राई की गई है। ये थेरेपी में ऐसा होता है कि जो पेशेंट्स ठीक हो गए हैं वो कैसे ठीक हुए, वो इस तरह से ठीक हुए कि उनकी शरीर में एंटीबॉडीज़ बनी जो इस वायरस के अगेंस्ट लड़ सकी और वो वायरस को अपने शरीर से निकाल पाए। ये एंटीबॉडीज़ जो हैं ये शरीर में रहती हैं, खून में रहती हैं, और जब ये इंसान ठीक हो जाता है तो तब भी ये ब्लड में रहती हैं। और अगर हम उनका टेस्ट करके देखें कि ये एंटीबॉडीज़ हैं और उसको कहीं वो इंसान अपना ब्लड डोनेट करे और उसका हम प्लाज्मा उस ब्लड से निकालें तो उस प्लाज्मा में ये एंटीबॉडीज पाई जाती हैं।
And in India, one such effort is being led by Professor Vijay Chaudhary at the University of Delhi South Campus Center for Innovation in Infectious Disease Research, Education and Training. Professor Chaudhary's group is isolating the gene encoding the antibodies which can neutralize the SARS-CoV-2. He is using a large antibody library already available in-house, as well as a library made from cells of patients who have recovered from COVID-19 infection. These antibody genes will be used to produce the concomitant antibodies in the laboratory, which, if successful in neutralizing the viruses, will become a perennial source of antibodies against this virus. And moving on to next development, Assam Chief Minister Sarbanand Sonowal today chaired an all-party meeting in Guwahati on the COVID-19 situation in Assam. Chief Minister said that all parties have asserted that they are all together in this spirit of Team Assam will win the battle against coronavirus. Leaders of all the political parties passed a joint resolution to thank frontline health workers, security forces and all those fighting against COVID-19 pandemic. Leaders from the Assam Gan Parishad Congress, AIUDF and BPF, among others, attended the meeting. And international good news that British Prime Minister Boris Johnson has been discharged from hospital. He will not be returning immediately to work. He thanked the medics and the staff of the National Health Service for saving his life after he tested positive for the coronavirus, saying he owed them his life. Johnson would have completed a week in hospital on Sunday. He was shifted there with persistent COVID-19 symptoms. Meanwhile, thousands of Get Well Soon cards have also poured in for the Prime Minister Boris Johnson since he went into self-isolation. Asked about plans for his return to work, UK Home Secretary Priti Patel said that the UK PM needed time and space to rest and recuperate and recover. And that was all in this edition of Doordarshan News, but stay tuned and follow the guidelines of all the Ministries of Health and the lockdown to save ourselves and also to save our families and the society members. Till then, namaskar.